the patients that have come in that have been treated conventionally with costochondritis have reported to us that it was very ineffective. Right.
I want to share with you another finding that I'm seeing, right? I'm just calling it a finding.
We've had people that are very fit that have
Mm.
costochondritis, as they've been doing sports and working out rigorously all their life, and they just develop more scar tissue.
So, Dr. Taylor, is there hope for these patients? Welcome to the Taylor Method for Pain-Free Living podcast. My name is Dr. Hudson Taylor, and we have Dr. Derek Taylor on the show today as well. Today, we're going to be discussing three important topics regarding costochondritis, right? So, costochondritis, especially if you've ever had it or experienced it, is a very serious and debilitating condition. We're going to dive into it. Dr. Derek Taylor, what is costochondritis?
Well, costochondritis is inflammation of the cartilage here along the sternum where the ribs attach from the thoracic spine here to the sternum.
Hmm.
And it's usually caused by some type of trauma to that area. It might be somebody, they were playing a sport and a ball, or they had an impact here to the chest. I've seen it with patients come to the office and somebody gave them a big bear hug. I had think of a patient that came in and they had an adjustment that was a little bit too forceful. Um, and it can also come on insidiously from just past accumulated traumas that have accumulated in the body. And either way, that trauma there, whether it is a macro trauma, meaning like an injury that has occurred from the past, from a sports injury or some other incident, or micro trauma that's something that's just occurred through the activities of daily living over time, this area becomes very inflamed and it's very painful and debilitating. The pain can not just be here in the chest, but it can also radiate to the back and along the ribs and along the sides and the flanks. So it's a pretty
Hmm.
painful condition.
Yeah. So going back to what exactly it is, you mentioned a couple of words here, like the sternum, the cartilage, and the ribs. So you know, if you look at this model here, and you see you're looking at, or you have someone's chest, right? What exactly is becoming inflamed or painful?
Yeah, well, it's right there, right where the ribs attached onto the sternum. So
Okay, so
so the
right over here.
ribs attached to the cartilage and the cartilage attached to the ribs. And so those areas and through there, it can be right where your finger is right there, or where it
Yeah.
attaches onto the sternum,
Okay.
or anywhere along. The pain can be felt anywhere though, but it's usually like going to be a inflammation in those areas in the front
Yeah.
chest.
So you have the ribs here that run along, and then it starts to become cartilage, right?
Yes,
And then that cartilage attaches to the sternum and,
correct.
and the breastbone, or the middle of the chest. So you're saying that sometimes the patient can have pain where the rib bone attaches to the beginning of the cartilage here, and then
Correct.
sometimes they can have pain along that, and then even where the cartilage attaches to the sternum.
Hmm.
Is that true? Okay.
Yeah, it can be along anywhere where the ribs, from where it's mostly going to be in the front, but we've seen it refer and radiate pain up to the side where the flanks are, where even where the rib is, apart from the
Mhm.
cartilage,
Right.
and also that grows around the back, because in between those ribs there, you have intercostal muscles that can develop scar tissue and uh, be an exacerbating condition to costochondritis.
Okay, got it. So in between the rib muscles, there's muscles, right?
In
A
between the
lot of
ribs are
muscles.
muscles, correct? Intercostal muscles,
So those are called in between the ribs costal muscles, right?
correct?
So those areas can become painful as well, correct?
Correct.
It seems like patients who have this condition, like it can become so painful that sometimes they go to the emergency room, right? Have you seen that
Right?
before?
Yeah, they think they're having a heart attack, especially
Uh-huh.
when it's on the left side of the body. Yeah, it can be so painful and so sharp, and it since it's affecting the ribs, and it's affecting those intercostal muscles. It can affect their breathing. It can affect their, it can mimic symptoms of a heart attack. And so they're scared. So they'll go to the emergency room. And that's where they're often first diagnosed
Yeah.
because they'll run a battery of tests and they'll determine, no, this is not coming from your heart. Your heart looks good. We're going to look at this as costochondritis. And so, but the challenging part for that is the treatments the patients that have come in that have been treated conventionally with costochondritis have reported to us that it was very ineffective, whether it's steroid injections there or medications that they're given. Uh, there's really no other treatment that they give because it's a very delicate area and it's pretty complicated. It can be pretty complicated,
Pretty
and
complicated.
um, the one of the biggest reasons why it's not resolved is because it's that those areas there are laden with adhesive scar tissue that has not been addressed or discovered that's causing those imbalances and the pain. And so they can get all the injections they want and they can take all the medications they want, but till you address that scar tissue and relieve that and alleviate it, that's not going to resolve.
Yeah. So
And
even
we've
so, I'm sorry.
Go ahead.
So there's right off the bat, there's three tissues that are involved in the inflammation of costochondritis, right? So there's the rib bone itself that could be inflamed. There's the cartilage itself, the breastbone, right? So the bones, the cartilage, and then even the muscles in between, right?
Correct.
So right off the bat, there's multiple things that are involved here, which is why when they're treated at the emergency room, that's why it probably can be tough to
Right.
pinpoint the exact right treatment because it's already a complex issue right off the bat, right?
Right. And then when you
So,
say cartilage and bone, you're also talking about the joint where the bones and the
ah,
cartilage meet.
in the joint too.
That junction there where those two meet, cartilage and bone, that is often inflamed and problematic. But that's usually secondary to the scar tissue that is
Right.
formed in those areas.
So, before we dive into the scar tissue, a lot of times too, have you seen patients with costochondritis who also start to develop shoulder pain,
Yeah,
right? Or even
absolutely.
elbow pain or neck pain, right?
Yes.
Back pain. It
Yes.
seems to spread, right?
It's all well. I don't. I'm not sure if that's spreading or if that is what is a contributing factor that led
Hmm.
to the costochondritis in the first place.
Okay, okay.
Right.
Got it.
So oftentimes when we have people come in with costochondritis, one of the first places we're working is actually the back, the
The
muscles
back,
in the back,
right?
because everything's connected and every part of the body influences the other parts of the body. And so you have dyskinesia in the scapula there. You have a scapula that's not working properly. It's not
Yeah.
moving properly. And you have 21 different muscles that connect to that scapula, that shoulder um, bone there. And if that is not functioning properly, that's going to be pulling on those tissues and those structures in the front, contributing a lot to the costochondritis. And so oftentimes
Okay.
we're doing a lot of work to the paraspinals, the rhomboids, all the rotator cuff muscles, all the muscles
So,
there in the back, as well as the neck and shoulder.
I had a patient who he's in his 20s now, but when he was in middle school, he was his friends, him were monkeying around in the locker room, and one of his friends pulled the shoulder too hard, and the shoulder dislocated, and then he got the shoulder relocated. But then after that, he started to develop pain in the ribs, and it led to chronic costochondritis that he had for years, right?
Hmm.
So it actually his costochondritis all began after a shoulder injury,
Right.
right? And then you mentioned that also the back is involved, the shoulder blade that goes along the rib cage is involved, the neck, etc. So, like you said, sometimes costochondritis, the pain in the chest, can come from areas that are totally that are next to the chest, but not necessarily right on it, like the shoulder, the back, etc.
Right. And so you
Right?
have this dysfunctional joints there, whether it's the shoulder or the neck or the back or the front chest area, and this areas they're not remediated, they're not resolved, and it just perpetuates. A lot of times they'll tell people when they go to the emergency room, "Oh, this thing should resolve in a week or two." We've seen people with costochondritis for years,
Yeah.
for
So
years.
root cause number one, you mentioned uh, old injuries and traumas that could even be outside of the chest. Shoulder
Absolutely.
traumas, shoulder blade traumas, back traumas,
Yeah.
accidents, falls, slips and falls, right? That's one of the root causes, an old
Right.
trauma that may not seem to be related, but it is. It totally
Correct.
is, right?
Yes.
And then number two, you mentioned what's something called adhesive scar tissue, right?
Correct.
So what's briefly what exactly is that, and how does that cause inflammation of the rib cage and the cartilage?
Well, adhesive scar tissue is, your muscles and the soft tissues are formed with like fibers that align up parallel to each other. And you'll have a trauma and they'll separate, and the body sends blood to that area. That's what causes inflammation. But within that blood, you have little cells called fibroblasts that just, those fibers are separated. So these fibroblasts come in and just lay out all this collagen everywhere and fibrous tissue to mend that that tissue. And then
Mm,
what happens, instead of realigning like this, it is just going to be a conglomeration of tissue, and it's like uh, that area, that tissue becomes less elastic. It pulls on the surrounding joints that it's connected to, and that tissue being shortened causes the dysfunction and the lack of that body and ability to work properly, and so that will perpetuate inflammation in those areas and cause pain. So you got to break that up.
so it's like a tangled up knot of just
Tissue, fibrous tissue.
tissue.
Yeah,
It's
it's
like a
like it's like
ball
the
of
yeah, it's like your muscles should be like filet mignon. This is like becomes like chuck steak.
okay, this is like a thick,
Like
yeah,
$1.99 a pound. It's just like
chuck
tough,
steak. It's
fibrous. It's like gristle, and
right.
so all of that creates a lot of imbalances. And you have to address that area. You have to
Yeah.
correct that. We've seen people. They've purchased like the back that so many of the patients, they go
The
online and
back
try to
pod.
resolve. They buy the back pod and they're laying on that, but I've never seen that resolve somebody's costochondritis. Maybe it has been helping some people, and
Yeah,
they
no,
don't come to
definitely.
see us, but
No doubt.
they're laying on that to try to open that up. But whether it's exercises or laying on a back pod or injections, if you're not addressing the scar tissue, it's not going to resolve the problem.
And quick work on the back pod. No, it seems like there's always been some sort of relief or improvement. Maybe yes, maybe not. Right? It's kind of helped it, but it's not going to help someone if the root cause of their costochondritis is coming from you know the shoulder, right? Or really
Right.
deeply embedded scar tissue in the rib cage that a massage ball or a foam roller or a back pod can't necessarily get to because it's so deep, right? Right.
Yeah. Well,
So
back pod is not designed to break up scar tissue. It's just designed
take pressure off, right?
to open
Yeah,
up that area, and because it's like
right.
this and it's pulling, and so, but it's all the patients that have come to see me that have gotten it. They None of them have ever told me that it brought any type of relief. So,
Yeah, yeah,
but I'm just speaking from what patients have told me that have come to see us. Maybe there's some that have benefited from that, but none to
yeah.
that we've seen.
Right. So you have the old injury and the old accident that was never addressed. The scar tissue, the tangled up chuck stick can happen, and then that scar tissue can start to pull and throw up, pull on other areas like the chest. It can start to cause a stream of inflammation, right? That can creep into the chest, right? It's all interconnected,
Yeah, and the challenging
correct?
part of why it is prolonged too is because all the breathing muscles are attached to that. So you're
The
constantly
breathing
breathing,
muscles. Yeah,
right?
the
You're
breathing muscles.
inhaling, exhaling. You have lung tissue underneath that, and
Yeah,
so that kind of perpetuates the issue, and their breathing becomes more shallow,
yeah,
which affects the rhythm of their breath, and so it can be pretty complicated by the time
Mhm,
people come to get in and see us.
mhm. And Dr. Taylor, you think about the intercostal nerves or the little nerves that come out of the spine, right?
Hmm.
Those nerves wrap all the way around and they go into the chest too, right?
Correct. Yeah, and those nerves get trapped in that scar tissue.
Trapped.
Yeah,
Right.
it's those subcutaneous nerves. They get trapped in that scar tissue. It's like in a mesh,
Hmm.
and they're constantly irritated. They're
Got it.
constantly there's constant interference,
Right.
which creates issues for them, and this is um, a big problem for patients.
So another root cause is the nerve entrapment from the scar tissue. The nerves that are
Hmm.
being squashed by the tissue, right?
Right.
I want to share with you another finding that I'm seeing, right? I'm just calling it a finding. It's a finding that I've seen over and over in patients with costochondritis, and I've noticed this. A lot of the male clients who have costochondritis also have. I've seen this called gynecomastia, right? Which is the formation of like a breast tissue almost, like in the
Mhm.
in the males, where the
Right.
the, the area starts. Now I've noticed that over and over again, and it's just I couldn't help but tie the two together, right? Let me ask you, what is that gynecomastia or the that breast formation in the male? What's that a sign of?
Well, there's a lot of different reasons for that, but one of the most common ones is just estrogen dominance.
Estrogen dominance, right?
Yeah, they're estrogen dominant.
Yeah.
They're eating foods that have been laden with hormones, whether
Mm,
it's cow's milk or cheese or hormones injected in conventional beef and chicken. And
mhm,
these hormones are designed to um, make the animal fatter so they can get more meat and they can be more profitable. But those are passed on into our, as humans, and then it'll create estrogen dominance. And so, with that estrogen hormone increase, you'll see breast start to develop with
right.
male, and then that additional weight on the chest also pulls on those rib muscles. And so, one of the signs of estrogen dominance is that men will have these men and women, they'll have those little red dots
Mm,
on
mhm,
their chest or their different parts of their body. These little red dots are a sign that they're in estrogen dominance, and so um, that creates an issue for them, and their
yeah.
hormones are out of balance. And yeah, that's a really good observation that you made. I really never even thought of that.
So that
Doc,
hormone imbalance, thank you. So that hormone imbalance in the males looks like the gynecomastia, but then also how is the quality of their muscles, right?
yeah,
And like in their
yes,
tissue,
less, right?
like how is it normal or is it easily more inflamed, right?
Yeah, I
How
think
how
it's
what
gonna
would you say?
I think it's gonna be a little bit in a weakened state, and it's gonna be
Weakened
weaker
state,
and more susceptible
inflamed,
for tears and more susceptible for problems.
and just inflammation that just does not go away, right?
Correct. I mean, it's all that's a really good observation that you made. I really never even thought of that.
So that
Doc,
hormone imbalance, thank you. So that hormone imbalance in the males looks like the gynecomastia, but then also how is the quality of their muscles, right?
yeah,
And like in their
yes,
tissue,
less, right?
like how is it normal or is it easily more inflamed, right?
Yeah, I
How
think
how
it's
what
gonna
would you say?
I think it's gonna be a little bit in a weakened state, and it's gonna be
Weakened
weaker
state,
and more susceptible
inflamed,
for tears and more susceptible for problems.
and just inflammation that just does not go away, right?
Correct. I mean, it's all works together. The healthier some,
Yeah.
the poorer the health of someone that comes in them, and if they have costochondritis, the longer and the more prolonged it becomes. Yet on the flip side of that, we've had people that are very fit that have
Mm,
costochondritis, and that fitness is their body's very fit and they taking good care of themselves. Challenging part with those people is they've been doing sports and working out rigorously all their life, and they just develop more scar tissue because they're working out. Their scar tissue is developed when they're breaking down muscle. So they're working out. That's a one way of breaking
Yeah.
down that muscle and developing scar. That's how the muscle grows and gets
Right.
larger. So
Absolutely.
they have a lifestyle of fitness and working out for decades, and then this is just they never get any the scar tissue work where that's being maintained or looked at or kept at check. And so now they have some type of trauma or some type of incident that sets them off, and they can't get out of that storm
Yeah.
of
Yeah.
pain.
So in those cases, would you say that the cause of their costochondritis is primarily it's more of a scar tissue physical aspect where they're healthy, they're fit, they're eating well, but they just got a lot of unresolved tension that's just built up,
Absolutely,
right?
sure.
But then what happens when you have a person that just more of a normal person that doesn't train a lot, and they're just maybe they play video games a lot, or they have a desk job, right? They don't exercise all the time, but then they get their chest bumped, and next thing you know, they have costochondritis for the next 2 years, right?
Well, everything they're doing is in front, right? So their
Okay.
shoulders are rolled forward, everything
Yeah.
tightens up in there. They're doing this all day long, and so everything gets tight. And then now they create a bump. Now that tissue is already shortened.
It's already
Now you
short.
create scar tissue in there. Now you just shortened it even more. So it's like adding
Mm.
fuel to the fires, pouring
Like the straw
gasoline
that
on it.
broke the camel's back, right?
Right. And then
Yeah.
they still stay in that state, and then they can't get out of that there.
Mm.
So
Hmm.
um yeah, it can, and this is another factor that
Yeah.
needs to be looked at.
Here's another thing I noticed too with some of the more female female patients. 3 patients I had were female recently. One of them just got pregnant, right? She just got pregnant. She was also eating a lot of soy too.
Hmm.
Soy. The second one uh, started after her costochondritis started, uh, and it just so happened that she just started doing soy protein shakes for the past 2 weeks,
Hmm.
right?
Yeah.
Then I had another lady where she works at or worked at Starbucks, eating a lot of foods from Starbucks that she chose that were just not healthy, and then also I'm sure a lot of those foods were laced with a lot of those inflammatory compounds and chemicals. So, you know, soy is a major driver of like toxic estrogen levels, right? And
Yes.
a lot of soy is genetically modified, right?
Correct.
So that's just a common thing that that I noticed. I just want to
Well, it
throw that
goes
out
back to
there.
just inflammatory foods in general, like whether it's gluten or dairy or sugar or something processed.
Yeah,
That food, if their body's sensitive to it, that's going to create even more inflammation at the joint level
yeah.
or in those areas and exacerbate the problem. So,
So diving into the treatment aspect of costochondritis, I'm going to ask you a question here. I also want to say that look, you have to if there's any of those components in your lifestyle with the food, the diet, the inflammatory things like soy, sugar, dairy, gluten, etc., you have to consider making a significant change to your diet in conjunction with any treatments that you get,
mhm,
right? You're going to get better results like that. You may not have to, right? But you're going to get better results if you start cleaning that stuff up, right?
correct.
And then
Absolutely.
I want to ask you, you know, what's a proper treatment for costochondritis?
Well, first, you got to identify where the imbalances are, and looking primarily a lot at that adhesive scar tissue. And so we use our Taylor method evaluation to figure out exactly where that is and where it's coming from. And we start to go after it as far as breaking up the scar tissue using various forms of modalities and uh, technology to break it up.
Wow.
And when you do that, you can see instantaneous improvement and relief even from the first visit. And and they finally have a ray of hope. But what
Mm,
happens is it feels good when they're at the visit, but when they leave, then the pain comes back to a degree, not as bad, but it's still there because there's layers of adhesions. And this
layers.
is
Yeah.
taken, the compensation patterns that have developed over time have gotten ingrained in the body, which has made it more ingrained in there to and more difficult to relieve that scar tissue. And the other thing is, people that come to see us that have a costochondritis, if
Mm.
they had come when they first started experiencing the pain,
Mhm.
you could cut down the treatment frequency and time of relieving it in half.
Mm.
But we often see people that have come, they've been waiting for weeks, months, years, um, and uh, at this point, it's become so complex that it takes time to resolve. We've seen costochondritis resolve anywhere between 6 to 36 visits or even more. Sometimes it's
Yeah.
less. Sometimes you can, if they catch it early enough and it's not as complicated, you can resolve it in a visit or two. But everybody's different, right? And everybody
Mm.
comes with a different degree of stressors that have been affecting the body, and you just have to go after that. And once that adhesive scar tissue has been addressed, you also need to get the joints aligned with adjustments. But you have to be really careful when you're adjusting costochondritis, because one wrong move, you can exacerbate it and make it worse. So, and
Right.
this is what can happen if somebody has they have costochondritis and they get adjusted in an area and it's too forceful, or it's the
Mhm.
level, or the wrong specificity, and reducing that subluxation. We've seen things get exacerbated with that. So you have to treat that very carefully, and you have to be really specific on where you're adjusting, not just in the spine, but in the clavicle, the shoulders,
Yeah.
the back, the neck. You have to look at the body as a whole. How many times people, they're having that pain in the chest, but a lot of the costochondritis issue has been coming from scar tissue just in the very back. But
Yeah, and how many times, Doctor Taylor? I mean, we're both chiropractors. How many times have you seen patients who've gotten adjusted, but and it made it worse, or just didn't get better, right?
right, well, or that's what may have caused it in the first place, if it's
Caused it in the first
too
place.
much
Yeah.
force. And so, and then
Mm.
there's you combine that with, you know, people hold a lot of their emotional and mental tension and stress in that chest area. You combine that with an adjustment at the wrong time or in the wrong way, and that can perpetuate and exacerbate the area for sure.
Mm. Hmm. So, Doctor Taylor, is there hope for these patients? Is
Oh, absolutely. Yes.
Yeah.
Yeah. We've seen incredible results and in tremendous relief and resolution with people that have been able to knock out the scar tissue and um, get down to the whole bottom layer of the scar tissue and get everything corrected. And then you start working with them with exercises that are going to be specific. And some people say, "Hey, what exercise can you give me?" There's one good exercise that we recommend for a general sense, where you're lying on your back and you're doing this, lying in your. It's on our YouTube video for costochondritis. You just put that in. There's a good video that shows you how to do that, but because it's opening everything up. But
Yes.
really, you have to do an exercise program that's custom made, because it depends on where the scar tissue is that's causing the problem that you need to address, and strengthening those areas that are weak and
Right.
stretching out the areas that are tight and problematic. So you have
Hmm.
to be really specific. There's not one catch all. Just do
Got
these
it.
exercises and that'll resolve it, right?
Right. Right. So figure out the unique problem, what's going on for that unique person, and then you got to get on the right treatment plan that is specially designed just for you and what's going on with you
And
and
then
your
also just looking at their diet. I mean,
look at the
if they're
diet and
eating
all that too.
inflammatory foods, you have to
Yeah.
do some testing to find out which foods are creating the inflammation in that area, and they need to
Yeah.
start getting off of that. And if they start to do that, uh, you know, we've seen for people that continue and follow the recommendations and get all the care that they need, we've seen up to over a 90% success rate with
Absolutely.
resolving in everybody, even from
Absolutely.
the first treatment. I've never had somebody that didn't respond at least
Positive.
positively in the
Yeah.
first. Have you?
No, no, yeah, they're excited and
Yeah,
they feel the difference. Yeah.
yeah.
Definitely.
No, it makes a big difference.
Dr. Taylor, you put up a really good video on YouTube with a really good explanation of this as
Didn't
well.
you create a didn't you create a video recently with costochondritis?
Yes, I did. I would encourage you, go to Dr. Derek Taylor DC, subscribe to our YouTube page, watch Dr. Derek Taylor's video on his explanation, some tips that you can even try at home. Because we're getting messages from people in different countries,
Right.
different
Yeah.
states. So you may
Well,
not be able to come to the offices, but Dr. Taylor's in Florida, I'm in Torrance, right? But subscribe to the YouTube page, watch Dr. Taylor's video on that, and then watch the testimonial on one of the most severe cases we've ever seen of costochondritis and how he got better, and then watch the example of the treatment that's done too. You can see that on YouTube, and that may help you.
yeah. So we have if you're on the East Coast, and we have our office in Palm Beach Gardens, Florida. If you're on the West Coast, Torrance, California, and just we're here. I mean, we've we've it's such a unique condition. This is why we're talking about it. But
Absolutely.
I have yet to find something that is more effective for reducing the effects of costochondritis than breaking up the adhesive scar tissue, specifically where those issues are. And have you come across anything that's
No,
more effective for that?
right, and then just working on getting that inflammation out of there. You know.
Right.
So anyway, Dr. Taylor, any closing thoughts at all before we sign off here?
Just there's hope. There's
Yeah,
hope.
I would say
There's a
that
lot
for
of
sure.
hope. I mean, people, they come in there at their wits' end. Some people have been um, it's been extremely debilitating and depressing for them, suffering with this without any answers. But there is hope, and it can be resolved.
Absolutely, absolutely. Well, thank you, Dr. Taylor, for your time. Thank you so much, everyone, for listening. We really hope this information helps you out, and don't hesitate to reach out for additional just help during this time. So, thank you very much. This is Dr. Hudson Taylor and Dr. Derek Taylor signing off. Have a great day.